All right, so we're going to talk about COMLEX Level 3. Um, this is predominantly for, the students here and residents here at Magnolia, um, and anybody else that wants to look. And we're just going to try this YouTube channel as kind of the format to do it for most of this stuff. So we're just going to kind of cover a little bit about COMLEX Level 3 and kind of where to go and how to start and where to start and why to start where. So here we go. So a little bit about the exam. Um, Big thing is, you can go to this website here and kind of look up all that you want to know about the exam, published by, the MBOME website. Some changes have taken place recently. One is the clinical decision-making cases. Of note, when I took COMLEX Level 3, this was not a part of the exam, so I can't help a ton here on what it is or what it's about. But they do have if you go to this link, have a link that you can go to from there that actually gives you a little practice test section on these clinical decision-making cases. And I think this is just one section of the exam, and in that section, it's kind of type in answer from what I've heard. Also of note for COMLEX Level 3, the score goes down a little bit to pass. It's a 350 for passing for Level 3 versus the 400 for your Step 1 and Step 2. And just to kind of point into this, which we'll kind of cover throughout all this, this kind of brings you to the old adage for studying for Step 1, Step 2, and Step 3. I always heard the 2, 2, and 2 rule, which is 2 months, 2 weeks, and a number 2 pencil. And this was Step 1, Step 2, and Step 3. So the number 2 pencil here was just basically to show up. This is not so much true anymore. The students and residents were all getting better at board exams and standardized tests, partially probably due to a lot of board preps and stuff like this, which are actually teaching the test itself. And if you teach the test, we get better at the test. So what's happened is, for the COMLEX Level 3, I think they've hosted like a 99% pass rating for the last couple of years. So this is not so true anymore. They're trying to make the test harder because of this. Because they don't like to see that 99% pass means that anybody could show up and take it and pass it that's gone through medical school. And they want it to be, this is a board certifying exam. They are trying to make it, that keep the public safe type thing. So going on from there, the blueprint. To me, this is one of the most important parts of the exam that just often gets overlooked. And even for Step 1, Step 2. I read one study that looked at a group of students. It was just one class size, so small sample size there. But just by looking at the blueprint, it increased your score by about 10%. That's just looking at it. So if you watch this video, you're looking at the blueprint right now. So your score should go up automatically by 10%. That's a joke. But anyway, with that being said, what does the blueprint do? It shows you where to focus and spend your time. A big part of this here is patients presenting with cognitive, behavioral, sensory, nervous, substance abuse, visceral pain, and sensory pain disorders. So this is where I would spend my time if I were only going to study one subject area. And then if I had time, I'd focus on these other high yield areas. And kind of work my way down. This would not be where I spent the majority of my time. You don't want to do that. If you do that, you're wasting your time. So you want to focus on the big areas. And that same thing goes for looking for COMLEX we have Dimension 1 and Dimension 2. This is Dimension 1, which is patient presentation. Dimension 2 is the physician task. This is the one that I liked better to look at, which basically just shows you for each level, what we're talking about. We're talking about Level 3 here, and we want to do management. Management is huge for Level 3. That makes sense. What does that mean? That the question you're going to get asked is, the question is going to be, what is the best next step in therapy? I can't spell, so that might be spelled wrong. Therapy or management of the patient. And so what does that mean? That means this could be a test or a treatment, and that's where they get you. So all your questions are going to have tests and treatments available. Not so many diagnosis. Remember diagnosis and history and physical or Step 2. And remember mechanism of disease was Step 1. So mechanism of disease, history and physical, and then management. And this is, as you progress through school and being a physician, this is what you do on the day to day is manage um, your clinical cases. Often, for me, I'm currently an internal medicine resident. Um, when they come out of the ER, we have the diagnosis 9 times out of 10. Um, and it's just management of whatever that diagnosis is and being able to manage it appropriately and correctly. Um, that's where I would spend most of my time. And once again, just kind of go from there. If you wanted, both of these dimensions, patient presentation and the physician task, basically have a more detailed outline that you can find there. Also going on from there, I like to talk about practice tests, and I do this with a lot of the medical students I talk to for about step 2. And the big thing here is that practice tests, I feel like they're probably the most underutilized and best way to prepare for exams, strictly because they show you your weak areas. And no one really likes to take a practice test and do poorly. So it doesn't feel real good. I like to use the word it hurts a little bit when you make a score that you didn't want to see, and which that kind of prompts you to do this. And I feel like a lot of board exams are really, at least for medical board exams, it's kind of a applied, maybe PPL, I can't spell, but applied knowledge. So what does that mean? DGE. So you basically have to go study it. So you don't just come inherently programmed with the fact that beta blockers decrease mortality and heart failure. But if you just go study that and then you get asked a question on it, you can apply it and then you get the question right. So while you're not programmed with that knowledge, you have to go actually acquire the knowledge, which involves you studying, and that requires effort, and that's how that basically all these tests are different than like IQ test. So you can have an IQ that's 166 or 182, and you still not be the best at med school if you're not willing to go out there and read. Now you might be better at acquiring the information if you go read and you were all to read equal amount, but this is why you can do really well in med school and not be the smartest in the group and still do just fine, and still do real fine on all these board exams and pass and not have any big real issues. So that's why I like practice test. It hurts a little bit, basically makes you study. Also weak areas, shows you where to focus. So the MBOME has one practice exam that they offer, and it's a COMSA Phase 3. Costs about $55. Money is an issue as always, and these do cost money. So something to note there. There's also a free 50 question test. That's just a link that you can click on. If you go back to that very first link and go there and click on that, you can scroll down and you'll see the free 50 question practice test. For the students residents here, if you go to the S Drive, there's a free print off test. It's a PDF. You're gonna have to print it off. But anyway, it's another couple hundred questions you can take there for free that are a practice test. The best thing you can do there is basically get your, it's just going to be your percent correct. And who knows what the percent correct it'll be passing, but I always like to tell folks aim for 75%. If you get 75% of them right, then you're going to pass. You don't have to worry about anything else. 75% correct is actually pretty hard to do, and that's usually way higher than just passing. But if you aim for 75, then at least you have a goal. And goals are good. You gotta have a goal, or you don't know where you're aiming. If you don't know where you're aiming, then what are you doing? And then also the clinical decision-making cases. They have that little practice section that you can do there. Also, UWorld has which I'll talk about in a little bit, the clinical skills or clinical something cases. Maybe it's just clinical cases. But you can actually buy that, and I think that's kind of similar to what the MBOME is doing. And you can get it's just a practice test simulator type thing. UWorld has a Step 3 Form 1 that you can buy. I think it's $35. And take it, see how you do there. Remember, it's not going to be exactly the same as your COMSA or your COMLEX, but at least it's something to try. Also, the MBME has a Form 4, which I believe this is $50 or $60 if you get the expanded version. My note to you is just buy the cheaper version. The extra $10 doesn't really provide you much. It tells you which questions you missed, so you see which ones you missed, but it doesn't tell you the right answer. So you just realize that you missed, problem 13, and this was problem 13, and that's the answer you picked. But it doesn't actually tell you anything else, like 14, or A was the answer you chose and it's wrong. B is the correct answer. It doesn't do that. It just tells you that you missed that one. So those are multiple practice tests that are available for you to take. Also, just any question bank. If you just get a Q bank and work somewhere between 300 to 400 questions, 400 randoms, and then get your percent correct off of that. That can serve the same purpose as a practice test. So, QBank, something here, to me, this is the best form of studying because it actually involves recall. And if you kind of read stuff on studying, learning, and how we get better at it, it's basically just practiced. Recall seems to be the best way to learn. And the only way to practice recall, at least the easiest way to practice recall, is through a QBank. You can do it on your own, even with just a sheet of paper, but practice recall. That's kind of the goal here. So cost versus goals. For step 2, which is, I tell the students, if you're aiming for that 99th percentile, then you need to pretty much buy every bank available. You don't have to. There's multiple ways to get there, and everybody does it a little different. But the way I suggest to them is buy every bank available and work every question available and pick a review book, 1 or 2, and then read it and find audio and listen. So that costs a lot of money. So a lot of money to buy every bank available if you go out there and do that. Banks are $300 usually to $400 a piece, and if you buy every single one, I think it's expensive. So cost for step 3 is to me where it becomes the most important, because most of us are in a residency, so we're not trying to impress anybody so that we can get an interview anymore. We're just trying to basically not necessarily just pass, but do well, meet our goals, and kind of go from there. So you want to do that as cheap as possible, and that's the other thing is goals. If your goal is to make a 99th percentile, I would suggest you buy a lot of banks and work a lot of questions. If your goals are to do average, or basically not make your program director angry, that would usually involve buying 1, maybe 2 banks if you just really want to try to knock the top off of it. But that's still different than 4 to 5 banks. And my other statement would be take a couple practice tests, try to go from there. UWorld, in my opinion, is the best bank overall, regardless of which one it is, if it's step 1, step 2, or step 3. Only thing is for step 3 or step 2 of the COMLEX, even step 1, it's just, this is a different bank. It is for the USMLE, which is not the same thing as the COMLEX. And if you're going to study for one, you have to study for each of these differently. You can't study exactly the same. So if you have to get a COMLEX directed bank, and in my opinion, ComBank is better than ComQuest. Everybody has their own opinion, so you gotta do what you want there. But ComBank to me is better than ComQuest. If I had to tell someone, hey, they said they wanted to make a 99th percentile on step 3, and they wanted to do it fairly cost effectively, first thing I would say is take a bunch of practice tests. Second thing I would say is buy UWorld, and you're going to work UWorld up until about 1 month before the exam, and then 1 month before the exam I would buy ComBank and try to get through that bank if possible in a month, and then that would prepare you. I would work this bank a little slower, and this bank would be a little faster. This one would be, the ComBank would just be for COMLEX style question recognition, and UWorld would be to actually learn off of. And also, there are a lot of other banks out there that you can learn from. And I know here at Magnolia we have a few available for us for internal medicine type stuff, and those are very legitimate and would work very well for our cases.